applied aspects of this genetics, there is no point. Just few more issues I like to review before we conclude. Neurofibromatosis type 1 is an example of a disease of variable expression. What is the meaning of that? Basically, neurofibromatosis is because of a tumor suppressor gene called as NF1. There is a loss of function mutation which lead to the development of neurofibromatosis. Everybody who carry this neurofibromatosis 1 abnormal gene need not have the neurofibromatosis clinically expressed phenotypically. It's an example of a variable expression. Which disorders are known classically for imprinting nature? Prader-Willi and Angelman. Lot of times this question has been asked. Prader-Willi, the problem is in the chromosome number 15. Anyway, we will discuss this in pediatrics once more. So 15, chromosome number 15. So when that deleted area of the chromosome number 15 comes from the father, then the person will show Prader-Willi. Papa se hoga Prader-Willi, Amma se hoga Angelman is what you have to remember. So what will they show, doctor, with Prader-Willi? What kind of phenotypic expression? The father gives that deleted segment of the 15th chromosome, failure to thrive, short stature, excessive eating, obesity, mental retardation, hypogonadism, and a facial dysmorphism is what is typically shown. Angelman means if that abnormal deletion of the chromosome number 15 comes from the mother's chromosome 15, then they show altogether a different type of clinical expression, which is devastating neurological disorder with severe mental retardation. And when you look at them, they will be funnily smiling, shyly. That's called happy demeanor. So next time when one of your classmates is very, very happy, you are only sad guy in the reading room, think that maybe I'm a very ambitious guy with fire in belly. This guy is a classical case of Angelman. You think like that. Don't feel disappointed. Mobin, when you read so much, too many facts for exam, you become a really unhappy puppet. So that time, any of your classmates is happy, don't react. Why are you happy, Bolke? Think that maybe that happy puppet demeanor of Angelman is what you try to think. Uniparental disomy. Typically, you need to remember Beckwith-Wiedemann syndrome. In these people, there will be macroglossia, overgrowth, severe hypoglycemia, ultimately malignancies of liver, kidney, adrenal, all because both the abnormal genes came from only one parent's chromosome. Uniparental disomy and Beckwith-Wiedemann syndrome, you should not forget. Which chromosome it is? Chromosome number 11. Which allele it is? Insulin-like growth factor 2. From whom will they get? From the mother's chromosome number 11. From the father's chromosome number 11. This also a lot of times asked. Uniparental disomy of the Beckwith-Wiedemann comes from mother or father? It basically comes from the father, is what need to be basically remembered. So that is all the story that we need to know in pathology about genetics, doctor.